Welcome. In this video, we are going to demonstrate order set personalization. Order set personalization will allow you to take an order set and to customize it to best fit your workflow. This includes such things as pre-selecting orders, changing the doses and frequencies of medications, and pre-populating required fields and comment boxes, such as that of the admission diagnosis, the MRP physician, or for example, your wound care preferences. You will also have the ability to sort the order set and move items around. Order set personalization can be a powerful tool. However, we want to ensure that we're still maintaining the standardization and best practice of the order sets as they are built. To maintain this standardization and the best practice, as well as ensuring we are maintaining our quality-based procedure requirements, there are some things that you are not able to do with the order set personalization features. This includes the ability to delete items on an order set, although you can rearrange them and move those unwanted items to the bottom of the order set, as well as the inability to add new orders. If you find that an order set does not have an order that you believe needs to be on there, we ask that you let us know, as therefore we can assess the need for that order, which is likely going to be a requirement and something that is wanted by other physicians and providers as well. You are also unfortunately not able to share your personalized order sets with others. To access the order set personalization feature, go to the menu at the top of the taskbar. When you click on Menu, you will see an item called Manage Personal Sets. Please note that to access the Managing Personal Sets feature, you must be in WebAcute on your tracker screen. You cannot access the Manage Personal Sets option when you're in a patient's chart or when you're in the WebED module. When you click on the Manage Personal Sets option under the menu button, you will be brought into the module that will allow us to go ahead and personalize your order sets. You are presented with your favorite order sets that you have selected, and you can choose from any one of these favorite order sets to personalize them. If you want to pull up an order set that you have not saved as a favorite, you can search for that order set here. The first order set that I'm going to demonstrate personalization will be in the hip fracture post-op order set. I'm going to go ahead and select this order set. When you select the order set, it's going to pull up the order set in the way that it has been built in the system. Once the order set has been pulled up on the screen, you now can go ahead and start the personalization process. If there were any fields that are required to be filled out, they would show up in red, and you would also have a button that says Next Required Field that would show up on the top of the order set. In this particular order set, there is no required fields that need to be filled out. I'm going to demonstrate further on in the demonstration video an order set where you will have some required fields that need to be filled out. These include such things as the admission diagnosis and the most responsible physician. In this particular order set, the reminders field has been closed or wrapped up. If you were to click on this, you will see all the reminder statements that are under this folder. When we built this order set, we kept this item folded up so that it would not take up too much space on the order set. If you wanted to have the reminder statements visible, this is an example of one of the order set customization features that you can do. To do that, you would click on the Arrange button. When you click on the Arrange button, you are presented with the different parts of the order set that you have the ability to arrange or fold up areas under one heading. For example, you will see here the Reminder section. Currently, these reminders that I had just shown you are all wrapped up under the Reminder section and not displayed in the order set when you first open it. If you did want to have these reminders displayed each time the order set was opened up, you could do that by clicking on the column that says Collapse and select No. This will now no longer collapse the order set reminders when you first open the set, and yet rather display all these orders. If I hit OK, you will now see on the order set that the reminders are now all shown. If, however, you do not want the reminders to be shown, you can return this back to the way it was built with the reminder statements being wrapped up under one heading by going back into the Arrange button, and under the Reminders group heading, you want to wrap up all these reminder statements under this one folder. You would select under the Collapse column, Yes, to collapse these all under the one item Reminders. If I hit OK now, you will see that the order set now has wrapped up all those reminder statements under this one particular folder here called Reminders, and each time you pull up the order set, it will all be wrapped up here and not be shown expanded. I can now go through the order set and select or unselect items that best match my workflow for this version of the personalized set that I'm doing. For example, I'm going to scroll down and select the activity restrictions that I would normally use. Going further down in the order set, under post-op wound management, I could put in my preferences for what I normally would use in this hip fracture post-op. I'm going to select remove post-op day 2, and I can change the comment that is pre-defined on this set. I can, for example, name a specific type of dressing that I want done, and I can put other further specific instructions around that post-op wound management dressing. Moving down further, under IV solutions, I will commonly have the saline lock placed once the patient is drinking well, so I'm going to select that as a pre-checked item. I will give ANSEF normally to these patients, so I'm going to also select that as one of my pre-selected items. And I will often give some Toradol as well as hydromorphone. So I'm going to pre-select these items as well. If the patient were to have an allergy to these items, you would still be alerted that there is an allergy when you go to order this medication on this patient. I'm going to move down further in the order set. I'm not going to make any changes to the VTE prophylaxis section because that's very dependent upon the patient that this is going to be used for. And I'm going to jump down to the laboratory section. I often will want a CBC in the morning, and I'm going to scroll down to medical imaging. I would like to have a view of the right hip as well done post-operatively. My referrals to Allied Health are filled out here and pre-checked. I can make any further comments that are specific to how I want to give instructions to the occupational therapist or to the physiotherapist. And under consults, if I want to go ahead and prepare any consults ahead of time that I would normally place for this patient, I can do that under this section here as well. And one further item I'm going to fill out on this order set is my referral to the outpatient clinic once the patient is discharged. So I'm going to select refer to outpatient clinic and office, and I'm going to fill out this section with my name. The family physician will be pre-populated, as well as the information on the patient's health card number will populate into this area for you. I can put the urgency that I want this to occur 1 week and what I want to happen at that time for staple removal. When I'm done filling out the items that I want pre-selected, rearranged, or any changes in doses. For example, the dilaudid has 1 to 2 milligrams PO-Q3H. If I normally would order this Q4H, I can make that change as well. Once I've done making these changes, I'm going to go ahead and hit save. It's going to ask me for the name of this order set. This is the hip fracture post-op order set. So I'm going to create this as my name hip fracture post-op. So you can put your name here and the name of the order set. Or it could be a version of this order set based upon the patient's condition. For example, an uncomplicated hip fracture post-op or a complicated fracture post-op that may have different variations of the orders that you would use. I'm going to hit save. You will now see that your personalized order set that we named here, my name, hip fracture post-op, is now listed under your favorites. I'm done now personalizing order sets, so I'm going to hit exit to get out of this function. I'm brought back to my tracker. If I now want to use that order set, I select the patient and I go to orders. And you will see that the my name hip fracture post-op set is now included as one of my favorites. When I select this order set, the items that I have created and pre-selected for my personalization will now be shown. For example, the non-weight bearing that I selected, my fluid choice, my antibiotic choice, as well as the pain medications with the updated dosing frequencies that I prefer. And at the bottom of the order set, the area where I have selected the refer to outpatient clinic will be filled out as you see here. I can then go ahead and submit that order set and those orders will be processed. I'm going to demonstrate one more example of personalizing an order set. This time it'll be an admission order set. I'm going to go ahead into the Manage Personal Order Set section of the EMR. I'm going to select the order set that I want to personalize. I already have it as one of my favorites. If it were not here, I could look it up under Search Order Sets. I'm going to pull up the Admit Pancreatitis order set. And then I can go through and fill out the order set and personalize it to how I want it to look. Here, I'm going to put in the attending provider, and since I'm going to be using this order set, I'm going to add the attending provider into this field here. The admission diagnosis already has pancreatitis. I can change that or add to that depending upon what I want for the admission diagnosis in this order set. And then I can go through and select items that I prefer to have selected for this order set. And I'll add the Pentalock here. Once again, once you're done with filling out how you would like this order set to be personalized, you can go ahead and hit save. If you want to rearrange the way some of these items are sorted on the order set, you can go into the Arrange button and you can select the particular item that you want to move around on the order set. For example, if you want to move the medical imaging and have the ultrasound above the chest x-rays, you could click on this and move that item up. If I hit OK, you will now notice when I go to medical imaging on the order set, the ultrasound now is the first choice. When I'm done, I hit save. I type the name of the order set. I'm going to call this my name pancreatitis admit, and then you hit save.